Good morning. Thank you for joining us for our coffee conversations here at Forge Breast Cancer Survivor Center. Today we have Vinnie Myers here, very excited to talk about breast cancer and tattoos. And I know that can be a very loaded topic. So we've wanted to have this conversation for a long time. And I'm super excited to have you here with us today. So Vinnie, tell us about yourself and the work that you do.
Well, it's a pleasure to be here. And as you were saying, it's always a strange conversation when somebody asks me what I do. And I say, well, I tattoo nipples on women. And then you get either a okay and a very standoffish reply, or somebody's very interested. It's kind of a mix. My name is Vinnie Myers is what I'm called. I'm from Baltimore. Was born and raised in West Baltimore. Graduated high school, joined the military. Started to tattoo on the side to raise extra money for myself because the military doesn't pay well. When I got out of the military, I opened a tattoo shop and traveled the world doing tattoos for 15 or 20 years. And then I had a client come in and just out of the blue ask me if I would tattoo nipples on her, and I didn't quite understand. And so once we got the conversation going, I decided I would do it. And then the nipple tattoo was born. And it's been what I've been doing exclusively for the last 12 years. And I work in 5 or 6 different locations around the country. And we just try to tattoo as many women and get their breast cancer journey complete.
I mean, how cool is that though? Like you just decided I'm going to do this side hustle with like, boom, like you're blowing up, you're traveling the world, you're doing something so specific. And so I don't want to say necessary, but for some it is, right? Like to just have some normalcy after such a big change in their life, right? So when somebody is thinking about getting tattooed, whether it's getting a mastectomy tattoo or getting a 3D nipple tattoo, what are some things that they should know as they're starting to think about making this change?
Well, there's a lot of things. I think most importantly, you have to know the anatomy of your particular reconstructed breast. So if you've got implants, if you have flap surgery, depending on what type of reconstruction you have, what is really safe for you to get or not. Because there are certain times, quite often, where a reconstructed breast has such thin skin or radiated skin or damaged skin that really should not be tattooed for fear of damaging the implant. So knowing your own anatomy, getting your doctor to approve the fact that you're ready to get these tattoos is critically important. And then finding the right person to do the job for you. If you're doing decorative tattoos, a lot of times those tattooers don't understand that anatomy and what's going on with that particularly reconstructed breast, and will just approach it like a regular tattoo, which could be dangerous. There are people out there who do exclusively nipple tattooing, and then they'd be more like the person you would want to see. Someone with a lot more experience on different reconstruction types.
So I like that you mentioned that because that's not something I thought about. I didn't think about the skin as it relates to like how thick or thin it might be and how that affects a tattoo. Because in my mind, I was thinking like, well, you just think up a tattoo, you think about what you want, and then you go and get it. So what are some questions they should ask their doctor, or something that they should think about, like, because like I said, I didn't immediately even think about like the level of your skin, the thickness of your skin. What are some good questions for them to ask?
To ask the tattoo artist, the doctor, or themselves, or what?
Both, like all of that, encompassing all of that.
I think that you should definitely ask your doctor if he or she thinks that you're ready to be tattooed. If you get that approval, then you can go on trying to find someone who has experience doing what it is you're looking for. So if you're looking for decorative tattoos, try to find somebody who's done decorative tattoos on a reconstructed breast, and then talk to them about your ideas and their ideas and what best approach they would think. So it's just sharing of these ideas with the professionals all the way along the way, from the doctor to the tattoo artist, because those are critically important for the safety of the reconstruction. That's the number one thing we're worried about. If you're looking for nipple tattooing, then you should find out how much experience the person has doing nipple tattoos, because once they're on there, they're on there. Yeah. And it's more difficult to fix for an experienced person, to correct that mistake than it is to start afresh. So, talk to the tattoo artist, make sure they show you examples of the work that they've done. A lot of times they'll say, oh, well, I've done them, but nobody lets me take pictures. Well, that's not true. So question that one. You know what I mean? I want to see examples of your tattoos, the ones you did, and then, look at the designs, look at the nipple tattoos and see what you think of them.
Yeah.
And, ask some questions about, if they use sterile equipment, ask questions about, their experience mixing these types of colors, ask their experience of working with different colors of skin, whether it's, a dark skin, an African-American skin, if it's, white skin, if it's radiated skin, if it's got hypopigmentation or scarring. I mean, all of these things an experienced tattoo artist should know. So if you ask the question and they don't understand what you're talking about, maybe you should look for somebody else. And I think one of the most important things is make sure that you are completely satisfied with your reconstruction and you're not looking to get any other revisions done. The tattoo should be the last step in the entire reconstruction process. Because if you go get the tattoos and they look great, but the shape of the breast isn't exactly pleasing to you, and you go back to get the shape corrected, now your tattoos probably aren't going to be in the right spot, or they may have to cut through them or something. Make sure you're satisfied with the results that you have before you go to get the tattoo.
Thank you. Again, and I feel like even it's just not even necessarily breast cancer specific. I think those are just good tips to have if you want to get tattooed in general. Like, you want to know that they have experience with your skin tone, your skin type, if you have radiated skin or eczema or whatever. I think those are really great tips.
Yeah, and you can expect that reconstructed breast tissue is going to be different than normal skin. You go in to get a regular tattoo, it's pretty much all the same thing, unless you're very, 80 years old, then it'd be a little bit different, but it's going to be the same approach to most people's skin. Now, when you throw in the reconstruction, all bets are off at that point. You've got to know what's coming in. You've got to look at it, be able to see the thickness of the skin, the quality of the skin, how deep you should set your needles so that you're not hitting implants or hitting something vital. And people really ought to be comfortable knowing that their tattoo artist knows that, so that, they're confident going in, they're not going to be in a heap of trouble.
So do you think it's safe to say, like, even prior to your reconstruction, it'd be good to mention to your doctor, hey, like, this is something that I'm thinking about after this surgery? Like, what are some things that you recommend? Do you think it's possible? Would you say it's kind of safe to have that conversation even prior to surgery if you can?
Sure, absolutely. And they could, if you have that conversation with your breast surgeon as well as your plastic surgeon, the breast surgeon may try an approach that would leave you with more subcutaneous fat than if not. That's not a guarantee, but that's something that you could certainly discuss. With your plastic surgeon, you can tell them, you're looking for something that's going to go around the periphery of the breast to accent the shape of the breast. And he'll be able to tell you whether, oh yeah, the dangerously thin portion of your skin is right here on the front. The bottoms and the sides have plenty of subcutaneous fat. They're very safe to tattoo. And, yes, that should be a conversation you have all along the way if you're planning on doing the tattoos. And you can also remember that your doctor is probably affiliated to someone who does the tattoos that he's seen the results of. So he may be happy to refer you to someone that he already knows. They may have somebody in-house that does it. I would question that a little more because they're not trained tattoo artists. They might be PAs or a nurse, but they're not a tattoo artist. So, be leery of that and make sure if you're in your doctor's office, they're willing to show you photographs of the work that PA has done, because you're going to want to see that, because that's what you're going to get on your breast.
Yeah. So after a person has talked to their doctor and, they get the go ahead or they feel comfortable, whether it's, and I don't know if you can kind of tell us a little bit of the different things that one can expect to have, or what they should plan for if they just get the 3D nipple versus the mastectomy tattoo, kind of like if there's any difference in planning and aftercare for those individuals.
Yeah, there is. Each tattoo artist is going to have their own aftercare instructions. It's going to vary based on their experience. The decorative tattoos, the mastectomy tattoos, as you call them, just remember that you can still get the nipple tattoos and get the decorative stuff around it. or incorporate the two somehow. So, you know, planning ahead with the design that you get and talking over with the artist what you want to have done, you can still do the nipples. I'm always a fan of get the nipples. And then if you want to do something decorative after you've done that and you see how the nipples have healed, then go ahead and move forward with the larger scale stuff. Don't dive into the big stuff right away, because if you have a problem with the big stuff, you've got a bigger problem.
Yeah.
And then just do the nipples. And, you know, my idea is always, let's get the nipples, let's finish the breast cancer reconstruction or the reconstruction, be as normal as you can be with what you've had reconstructed, and then move forward with the decorative stuff.
Mm-hmm.
That's the way that I've always, you know, talked with my patients about it. Let's just do the nipples first, and then, you know, we'll see what happens after that. Let them heal, and then you're complete. And you may be happy with that and not have all the other things, but still have the option to get the other things if you choose.
So what does like the recovery process look like? Is it like, I know that there are differences, obviously, just because of the area that's being tattooed, how it's being tattooed, and the things that you have to look out for. What does the recovery process look like for somebody who's, you know, I finished my reconstruction, or maybe I didn't have reconstruction, but I want that tattoo that goes across, you know? What does that recovery look like for them? Like anything different than your regular, like, you know, oiling it or moisturizing it and keeping it covered?
Yeah. So the recovery process is really pretty simple, but it's critical in the end result. So you have to follow the instructions to the letter. Don't, you know, break out some of grandma's special liniment and use that. You know, just do what the tattoo artist says, follow the instructions to the letter, and you should have a good result. 5 to 7 days, it should be completely scab free, and you should be good to go from there. You know, you're going to want to keep ointment on it, a thin coat of an antibiotic ointment on it a couple times a day. Wear nonstick pads when you have to wear tight-fitting clothing or a bra. No swimming pools or bathtubs, but showers are fine. Don't pick or scratch at anything. You know, a lot of common sense stuff. You know, don't go Jello wrestling or something. Just, you know, just follow the rules that they tell you and be smart about it, and you should be healed completely in 5 to 7 days.
So another question. Like tattoos are expensive, right? Like everybody can't afford a tattoo, whatever those tattoos might look like, especially, you know, something as detailed and specific and impactful as this. You know, somebody having breast cancer, just trying to take back some of their power via tattoo. I know that it can be very expensive. Like, you know, I have a tattoo myself and I didn't like the price of it. So I kind of wanted to lean into that and kind of lean into your Think Pink project, and tell us a little bit about those things.
Okay, so as far as the expense is concerned, there's an old tattoo saying that says, good tattoos aren't cheap and cheap tattoos aren't good. So if you want to, not saying necessarily that if you pay a lot more money, you're going to get a better result, but yes, to pay for a professional to have a professional job done on a compromised body part, you want to have a professional do that, and you're going to pay a little more money for that. That's just the way that it is. For people who can't afford to have it, we have set up a program called the Pink Ink Project, and we're in the process of getting, you know, website, social media and stuff made, where we have raised some money for people who can't afford to have that done. We're hoping that we can make this thing into a really good project that has a lot of money that we can pay for a lot of people's work. We do work with certain doctors that we just have the doctor tell the woman to call us and say that, you know, they're this person's doctor. Would you please, we'd like to make an appointment. And we've already got an arrangement so that they don't have to ask for the assistance. We already have an arrangement with the doctor. They're going to send us, and they're going to tell us the person needs it, so that they just call and get the appointment and get the tattoo. So our mission is to raise enough money that we can help as many people as we can in any way that we can. And otherwise, you know, if you would like to just get the tattoos, we'll do the tattoos for you. And we'll also be happy to take a donation at any time if somebody would like to donate to the cause.
Awesome. So how can someone get in touch with you all? Like, where are you all based? I know you said that you're in different places of the country. Could you talk a little bit about that?
Yeah, so we usually spend a week or two a month on the road. So we'll go to different cities, New York, Atlanta, New Orleans, San Diego, Birmingham, Alabama, and we'll people will call and ask us, I'd like to make an appointment, and we ask them, where are you calling from? And then we'll offer those other locations to the people if they'd like to do that. And then we'll make the appointment for them at that location, and they just meet us there. So what it's done is, when we were simply working in Maryland, it required all the extra expenses for the client to come to us. Whereas now that we're on the road traveling, we cut that down. So somebody might be willing to go from Los Angeles to San Diego, but not necessarily from Los Angeles to Maryland.
Right.
So this gives us the opportunity to offer the services to more people around the country that otherwise would not be able to make it.
That is so cool. And I love that. I love that you're thinking of the client in that way as well.
So we actually had a contract at one point with the hospital that wanted us to be exclusive, and it restricted us. And I felt like, if I can only work here and there, then that's really limiting. And it didn't. And so Anna and I talked about it, and we decided we weren't going to renew that contract, but we're just going to try to expand as much as we could while we still can. I'm 60 years old. I don't want to do this until I'm 80, but as long as I can, and to try to touch as many people as I possibly can during that time.
Well, I want to thank you for thinking of others in that way. And I'm so glad you didn't stick with the contract, because now you're traveling and helping more people. I have enjoyed this conversation so much, but before we go, do you have any final tips, any final thoughts that you would like to leave our viewers with, who are thinking about this, or who are curious about what does this mean, and how can I explore this for my own journey?
Well, if anybody has any questions, they certainly can call us or email us at any time and have their questions answered. I think it's really good to be inquisitive about this stuff, because it can make or break, for lack of a better word, the way you feel about yourself every day when you look in the mirror. If you look in the mirror and you didn't really do your homework on the tattoos or your surgeons for your reconstruction, or your breast surgeon, plastic, you're going to regret that for the rest of your life, looking in the mirror every day and be reminded that I didn't take those first steps I needed to do, and look at and talk to doctors and get many opinions as I possibly can. Talk to, if you're going to one hospital and they say, do everything here, you might want to still try to get an opinion from someone else. They may offer something that particular place or doctor does not. So unless you're in some critical stage with advanced, invasive, very progressive cancer that has to be taken care of right now, you've probably got several months that you can just sit back and kind of say, okay, let's hit the brakes here for a minute. They're trying to get me in next Wednesday, and I haven't even looked at what's available to me in all these other respects. It hurts me so much when a lady sits in my chair and she says, well, I got implants and I had radiation, and that's why this breast is way up here and this breast is way down here. And I'm thinking in my head, your doctor should have probably told you not to get implants because you had the radiation in the first place. So if you would have gone to someone, and I don't, of course, say it like this to them, but if you would have gone to this other person and seen them, they offer flap surgery, which would have been giving you a much better result in the end. So my advice would be, tap on the brakes a little bit, realize that you have some time. Time is on your side in that regard. Take those couple weeks or months to really look into it. And then when you get to the tattoo stage, don't make the mistake of jumping into that one head first either, because you can have a beautiful reconstructed that you really examined and you really got your education on how to do it. And then you get a crappy tattoo and then everything's no good, So every step along the way, really take the time to be your best advocate and really try to understand what it is you want in the end and how can I get to that point.
Well, thank you so much, Vinnie. This has been really awesome and so helpful. And we are so glad that you are a resource available for the breast cancer community.
Happy to be here for everyone.